Hello, my name is Ravi Vij. I'm from MyCancerHaven, and welcome to this video podcast. And today we have Dr. Russler-Germain, who's been with us on a couple of programs before, and he's an upcoming star in the field of lymphomas here at Washington University. And we're going to talk about some of the key abstracts in the lymphoma CLL group of diseases, the lymphoid malignancies, from the ASH meeting in December 2023. Welcome, David.
Thanks, Ravi. It's a pleasure to be here.
So, David, obviously, you've chosen a few abstracts here, and we're going to go through them one by one, and we're going to talk about the big picture, how these are, how the field of approaching these different, malignancies, and specifically in the lines of therapy are changing. So let's start out first with the first abstract, which is in Hodgkin's lymphoma, and you're talking about treatment of newly diagnosed, especially with a focus on older patients with Hodgkin's lymphoma. So, for the longest period of time, we used to, when I was in training, have these two regimens, MOP, which had gone away, and ABVD. But then I think the last few years now have seen a real change in the treatment with some FDA-approved new treatments and some of these cooperative group studies starting to change the landscape once again, Adcetris and now nivolumab. So can you put it in context, where are we going?
Yeah, so classical Hodgkin lymphoma is a slightly less common subtype of lymphomas overall. We draw the distinction between Hodgkin's and non-Hodgkin's. And as you mentioned, since the late 80s, early 90s, we've been using a backbone of chemotherapy called ABVD predominantly in America for the treatment of this condition. And it's highly effective. Most patients are cured with this regimen, but it's for classical chemotherapy drugs. And so the focus of many recent efforts in the field have been to replace the traditional chemotherapy drugs with hopefully more targeted and or safer agents. And so the Adcetris or brentuximab vedotin, BV, as you'll see in this slide, is what's called an antibody drug conjugate. And that's basically a fancy way of getting a small chemotherapy drug, hopefully specifically to the cancer cells using that antibody part of the design. And that was shown to be superior to ABVD, the quad chemotherapy, in the Echelon-1 trial published over the past two iterations of those results published over the past decade. But as in many cancers, from